Hello friends, today again we are going to continue with the subject health education and community pharmacy. In previous lecture we have covered about the definition of health. We know definition: person having sound mind in a sound body, in a sound family, in a sound environment. Also we have seen definition that is given by World Health Organization. Then we have studied the four important aspects of health: physical aspect, mental aspect, social, and spiritual. All aspects are important. Even if one aspect is lacking, so we cannot say that the person is healthy. Now, continuing with this first chapter, the contents in previous lecture also I have given you as they are displayed on the screen. So next is factors affecting health. That is the further topic that we are going to cover: factors affecting health. Now the factors affecting health, they are also called determinants of health. Factors affecting health or determinants of health or deciding factors, it is one and the same. So these factors affect either physical health or mental health or social or spiritual. So these factors are to be studied, and the question is asked on factors affecting health also. Now there are two categories: individual factors and surrounding factors or environmental factors. Individual factors: heredity, lifestyle, these two we are going to cover. Then in surrounding factors, three are there: socio-economic factor, political will, and availability of health services. Now these determinants of health, they are multiple factors, as we have seen the two classes. So multiple factors are there. The health of individual and community is influenced by individual factors also and surrounding factors also. So individual factors, internal, isn't it? Heredity and lifestyle, and external factors that we will discuss. Now the individual factors include by his own genetic factor, and external factors include environmental factors. Now these factors, they interact, and these interactions may be health promoting or deleterious. That means either they can promote our health or they can affect our health also. So health of individuals and whole community may be considered to be the result of these interactions. Now in individual factors, first is heredity. Now heredity, that is, in simple terms I will let you know, family history. Family history or genetic factor. Genes play important role here. The genetic makeup is unique in the sense it cannot be altered, isn't it? So whatever the genes they are received from parents when the child is born, so child receives genetic factors of both mother and father. This cannot be changed, and due to heredity also there are many diseases that occur. Now these, as I said, genetic characters they are received from parents. They play important role in the health and development of child. Now here some examples I will let you know which are of diseases which are due to hereditary factor only. Now here in your screen, chromosomal anomalies. Now then, errors of metabolism. So in most of the cases, due to lack of enzyme system or some other genes, there is metabolic dysfunction also. Then mental retardation. Many mental disorders are because of hereditary factor. Now other diseases I will just let you know. One is hemophilia. Now hemophilia is a disease, hereditary disease, in which the blood of patient clots very slowly. That is, clotting is not taking place due to deficiency of one of the coagulating factor. Then other disease is sickle cell anemia. It is a hereditary disease where the red blood cells become sickle shape. That is, they are abnormal shape. They are not normal shape RBCs, and that happens because of defective type of hemoglobin. And when the RBCs become abnormal due to defective type of hemoglobin, so the main important function of hemoglobin in body is to carry oxygen. So the oxygen carrying capacity is also decreased, and these all lead to anemia. Anemia. Then other disease is diabetes. So all of you are knowing about the diabetes, that is hereditary disorder. If parents are suffering from diabetes, there are chances that children may also suffer from diabetes. The other factor in individual is lifestyle. Now the simple meaning of lifestyle is Jeevan Shaili, lifestyle habits. Whatever the routine we have and the habits that we have in our day-to-day life. Now this lifestyle the person learns through social interaction with parents, with peer groups, with friends, with siblings, in school and mass media. Many current health problems are also there, like coronary heart disease, obesity, lathapana, stoolpana, that is the meaning of obesity, lung cancer, drug addiction are associated with lifestyle. Now, smoking and alcohol consumption, food habits, personal hygiene, rest and physical exercise, bowel and sleep pattern, sexual belief. So all these are the coming under lifestyle factor. Now this lifestyle plays a very important role in the life of individual. It may affect health in both ways. It may promote the health or it may affect the health, isn't it? This depends upon the personal activities that we have in our day-to-day life. Now all these personal activities like taking care of body, taking bath, taking care of teeth, taking care of hair, taking care of nails, and all habits, food habits, sleep habits, use of other drugs. This lifestyle we learn from personal experiences. If person has good habits, then he will have better attitude toward others, and the positive attitude towards the life. Then and then only he can enjoy all the aspects of health. But if a person has bad habits, then he will not have better attitude towards others. He may have bad habits like drinking alcohol, smoking, chewing tobacco, and then he may affect not only his family, but he also can affect the family or the health of family members, the health of the society and community also. So lifestyle is also a very important factor. Now we will concentrate on environmental factors outside the body. In that, the first is socio-economic factor. Now socio-economic conditions are also important. It consists of education, occupation and income. In socio-economic factor, whatever these factors are there, whatever we are discussing now, so they also can affect our health. What is the education? Whether the person is educated or not, what type of occupation he has, what is the income source. Then the world map of illiteracy closely coincides with the maps of poverty, malnutrition, ill health, high infant and child mortality rate. So because of lack of education, it is a socio-economic factor that is responsible factor for poverty, daridrata, malnutrition, kuposhan in Marathi we can say, ill health, high infant and child mortality rate. That means the death rate of small children is also high because of lack of education. Now the very state of being employed in productive work promotes health, because the unemployed usually show a higher incidence of ill health and deaths. There can be no doubt that economic progress has positive impact factor in reducing morbidity, increasing life expectancy and improving quality of life. So economic condition is also very important. If the person is financially sound, there will be all-round development in education, housing facilities, social relations and hygienic conditions. When all these developments are there, there will be improvement in standard of living, which will affect the health status of individual in many ways. Now, there are certain customs in a particular community or society. Some of the customs, they are very harmful to health. Like for example, serving wine on social functions. So many social functions are there. People have got habit of serving wine, which is not beneficial for the health. Other factor is dowry system. Hunda in Marathi we can say, Dahej Pratha, which is a curse which greatly affects health of individual or family directly or indirectly. Now, the income source, as I said earlier, it is very important. The occupation that we have and the income that we get, because this will overall raise the standard of living of individual. Also, the development of individual must not be limited to satisfaction of basic needs, but it must be beyond that. Like in society, wherever we are living, so basic facilities must be there. Provision of proper hygienic conditions, roads, street lights, sewer system, housing conditions, recreational facilities, all these are very important. So that is about the socio-economic factor. The second factor is political will. Rajnitik Ichha Shakti, that is political will. Now, this political system is also very important for the development of the society, and it also affects our health also. How it affects, that we will study. Health is closely related to political system of country. Often there are many obstructions to the implementation of health technologies, and rather the problems, they are not technical but they are political, because political decisions many times they are not taken very fast. Now we know that one of the social problem in our society is poverty, daridrata. It is a root cause of most of the health problems. People who are living in slum areas meaning jhopadpatti, they are easy target of many diseases. Basic facilities they don't have, like fresh water, proper food, houses, lighting, clean environment, education. So all these are lacking. They live under unhygienic conditions, especially the children's as well as the persons who are living in slums. So they are easy target of diseases. They can suffer from many diseases. They neither get preventive nor curative measures. So here political decisions are very important. If policies are framed, if decisions are taken, so all these facilities, as I gave you now detailed idea, all those can be provided to these poor people. Now decisions concerning resource allocation, manpower policy, choice of technology, and the degree to which health services are made available and accessible to different segments of the society are examples of manner in which the political system can shape community health services. So these facilities can be provided to the poor people when the political will is there, when decisions are taken properly and without wasting time, so that can promote the health status of these people also, isn't it? Then the third one in surrounding factors is availability of healthcare services. Now you must know that to be a healthy person is a fundamental right of each one of us, and it is the duty and responsibility of governments, maybe state government or central government, to provide healthcare facilities to all the individuals, maybe human beings, maybe animals or plants, so that all the individuals are healthy in all aspects. Now, availability of health and family welfare service. Health and family welfare service cover wide spectrum of personal and community services for treatment of diseases, prevention of diseases, and promotion of health. The purpose of health service is to improve health status of population. Now, here, apart from government, that is state government and central government, the private organizations also must participate to provide basic healthcare facilities to individuals at their own level so as to promote preventive, curative and promotive healthcare. Now here, how the private organizations can participate, for example, immunization of children's, vaccination, Tikakaran. So by arranging camps, what you say in Marathi, Shibir, so that can be arranged, and immunization of children can influence the incidence of particular disease. Then provision of safe water can prevent mortality and morbidity, that is the death rate and disease rate. Now what is mortality and morbidity? We will discuss in the next lecture. You will get idea. So mortality and morbidity rate can be reduced from waterborne disease. That means when the safe drinking water is provided to the general public, so that can reduce the death rate and disease rate in the society. Now the basic facilities which should be provided for primary health include, as I said, supply of safe drinking water that will minimize the ratio of waterborne diseases. Then adequate supply of nutritious food. So availability of fresh vegetables in the market is also the responsibility of the government or municipal corporation. Then proper hygienic conditions and facility for disposal of waste matter is also the facility that is to be provided. Then maternal and child health care. So family welfare programs, family planning services. So whatever the primary health care centers are there, primary health care centers, PHC. So they provide the maternal care and child health care, isn't it? Also they provide the essential drugs at doorsteps also in slum areas. So whatever the necessary drugs are there, common drugs are there, they are also provided by the primary healthcare centers at doorsteps also. Then provision for adequate medical facility. So medical facilities are also provided. It is the responsibility of the government. Then preventive measures against diseases. So how the diseases can be prevented in the society, measures are taken. Immunization against the infectious diseases. Then educating the people regarding healthy ways of living. So health education, making people aware about the healthy ways of living. So these are some of the important basic facilities which must be provided by the government. So that is all about the factors affecting health. Once again I repeat, the question is asked on factors affecting health. They are also called determinants of health. In this, two categories are there. One is hereditary and lifestyle, that comes under individual factors, and the second category is surrounding factors or environmental factors, which include socio-economic factor, political will and availability of healthcare services. Thank you.